Some patients with an ACL injury say, "My knee feels okay when I walk straight, but when I turn, pivot or change direction, it suddenly gives way." This is a classic feeling of rotational instability. And it is one of the most important reasons ACL injury affect athletes so much, especially in football, basketball, tennis, padel, skiing and other pivoting sports. Today I'll explain what rotational instability means, why it happens after ACL injury, and why treating the ACL is not only about forward and backward stability. I'm Dr. Tomislav, orthopaedic surgeon specializing in sports injuries and knee surgery. Most people know the ACL as the ligament that prevents the shin bone from sliding too far forward under the thigh bone. That is true. But the ACL also helps control rotation. When you run, stop, twist, cut, land or pivot, your knee is not moving in a simple straight line. It is controlling forces in multiple directions at the same time. So when the ACL is torn, the knee may lose control during these dynamic movements. This is why a patient may feel stable while walking normally or running straight forward, but unstable during sports and pivoting movements. Rotational instability means the knee cannot properly control twisting forces. Imagine the knee as a hinge, but not a simple door hinge. It bends and straightens, but it also has a small controlled rotational movements. The ACL helps guide and control these movements. When the ACL is torn, the tibia, the shin bone, may shift and rotate abnormally under the femur, especially when the athlete changes direction. This can create the feeling of "my knee slipped" or "my knee gave way," "I lost trust in my knee," or "I can run straight, but I cannot cut or pivot." That feeling is not imaginary. It can really be a mechanical instability. In a straight walking, the knee is usually under lower rotational demand. But in pivoting sports, the knee is exposed to the sudden combo of load, rotation, deceleration, and direction change. For example, a football player plants the foot and turns. A tennis player reaches wide and changes direction. A basketball player lands and cuts. A skier twists with the foot fixed. These are exactly the movements where the ACL is important. If the ACL is torn, the knee may not control the rotation properly. This can cause giving way episodes. And every giving way episode matters, because it can create new damage inside the knee, especially to the meniscus and cartilage. So rotational instability is not only about confidence, it is also about protecting the knee from the repeated injuries. The meniscus is also very important in rotational stability. The medial meniscus, especially the posterior horn, acts like a secondary stabilizer of the knee. In ACL injuries, associated meniscus tears, including ramp lesions, can increase instability. We also ask, is there a meniscus tear? Is there a ramp lesion? Is there a cartilage damage? Is there a bone bruising? Is there injury to other stabilizing structures? Because the knee works as a system. If one structure is injured and another hidden injury is missed, the patient may continue to feel unstable even after treatment. Rotational instability is assessed by combining several things. First, the patient's story. Did the knee give way during pivoting? Was there a twist or pop? Did swelling happen quickly? Does the patient avoid changing direction? Second, the physical examination. Tests like Lachman test help assess ACL stability. The pivot shift test is especially related to rotational instability, although it can be difficult to perform when the patient has pain, swelling, or muscle guarding. Third, imaging. MRI helps us see the ACL, meniscus, cartilage, bone bruise, and associated injuries, but MRI alone does not replace the clinical examination. The best decision comes from combining the symptoms, examination, imaging, sport demands, and the patient goals. Treatment depends on the patient. A low-demand patient with no giving way may sometimes do well with a rehab and activity modification. But for active patients, athletes, or people who want to return to pivoting sports, persistent rotational instability is a major concern. In these cases, ACL reconstruction may be recommended to restore stability and reduce the risk of repeated giving way. But the surgery must also address associated injuries when needed, especially repairable meniscus tears or ramp lesions, because the goal is not only to reconstruct the ACL, the goal is to restore a stable, functional knee that the patient can trust. So remember, if your knee feels stable while walking but gives way during turning, cutting or pivoting, that may be a rotational instability. After an ACL injury, the knee must be assessed by a complete system: ACL, meniscus, cartilage, bone bruising and overall movement control. The real goal of treatment is not just a good MRI report. The goal is a knee that is stable, strong and safe for your daily life or a sport. This video is for education only and does not replace a medical consultation.